This bill takes care away from 24 million Americans, and that's just wrong, whether they come to Planned Parenthood or not. That's just wrong. It will eliminate key protections that restrict insurance companies from charging people with pre-existing conditions and imposes unaffordable rates on the public. Health insurance companies could once again charge people tens of thousands of dollars more because they had cancer, for instance. It will take away key protections that require health plans to give quality coverage, including maternity coverage and prescription drugs. Under this new bill, 13 million women could lose access to maternity care, something that we find especially ironic combined with the restrictions on family planning that are happening right here at our state capitol. It will gut the Medicaid program, which approximately 1 in 4 women of reproductive age rely on to access no-cost reproductive health care services such as birth control, life-saving cancer screenings, and maternity care. And it will impose a nationwide ban on private insurance companies offering abortion care coverage. Simply put, this bill makes it harder to prevent unintended pregnancy, harder to have a healthy pregnancy, and harder to raise a family. That is just wrong, and Planned Parenthood opposes this bill, and we think the American people are about to let Congress know exactly how they feel, which is the same way. Thank you.
That's right. That's right. That's right. That's right. Well said, Jody.
Next up is Steve Gomez, journalist. I'm going to hand this out so you've got spelling. Steve is the parent of a child with a pre-existing condition, and he's going to tell his story. Welcome, Steve.
Try to get this up. No, it's not going to happen. No. Sorry about that. Thank you guys very much for coming out. Just here to share my story, my family's story, and talk about what the repeal of the ACA and the passage of this AHCA really would mean to families like mine and our son Anthony in the long term. After a very average pregnancy, my wife Laura gave birth to our son Anthony in September 2015. Seemed like a very healthy, happy baby boy, just a little tired. However, about 27 hours after birth, a truly awesome nurse at Mercy Gilbert saw some symptoms of a disease known as transposition of the greater arteries. Took him into the special care nursery, at which point he was truly diagnosed with that affliction. He was then flown to Phoenix Children's Hospital, where he spent 2 weeks gaining strength in order to undergo a procedure known as an arterial switch to basically correct that issue. While the switch procedure was successful, his heart just was not strong enough and he went into heart failure. He was then placed on ECMO, which is a life support device that oxygenates the blood outside of the body, then returns it. During this time, we had to discuss our options with our healthcare team, which ranged from other artificial hearts to transplant or saying goodbye to our son. We ultimately listed him for a heart transplant, and we're fortunate enough that another family was strong enough to grant us this gift of life only 4 weeks later. Truly unheard of. So at 6 weeks old, we sent our son into the OR, waited about 12 hours while the donor heart arrived and the surgery was successfully performed. At last, we had our beautiful pink baby. However, as a side effect of the ECMO, blood clots were formed in his extremities, causing a significant amount of necrosis, ultimately leading to him losing almost all fingers and toes and part of his right foot. In addition, he also suffered at least 1 stroke while at PCH. Our routine is now his medication schedule and his cardiology follow-ups, which will be how he lives the rest of his life. This year alone, we are now looking at possibly 2 more surgeries and the needed medications, therapies, including physical, occupational, feeding, and speech. Not to mention, we were in the hospital every other week from Christmas to St. Patrick's Day. Literally, every other week. And if this weren't enough, due to the amputations, Anthony will be subject to a lifetime of prosthetics and their accompanying therapies. Through all of this, as you can see in the picture, he's incredibly happy. He makes my face hurt as much as he smiles. He loves his older brother and is doing everything he can to chase him around. He's become more mobile, and we're now starting to win the fight on his weight gain. Through all this, we were fortunate enough to have employer-provided health coverage, but we have had to think about what we would have done or what we would need to do if we lost that coverage. Our hospital stay alone, just the room at PCH for the 10 weeks we were there, was in excess of $2.5 million. That does not include any of the surgeries, any of the doctor's fees, anything. His coverage needs will continue to increase as he has regular checkups, labs, medications, therapies, and then again the prosthetics. On top of it all, the reality is transplant is not his final cure. The question will not be if he needs another transplant, but when. Paying for this care out of pocket due to Anthony being excluded for a pre-existing condition or having met a lifetime or annual coverage limit is something that would devastate our family and is a reality that many families must face when a job is lost or changed. The AHCA that the Republican-led House has proposed and is voting on today is noted to gut essential protections such as fair coverage for those with pre-existing conditions and the elimination for coverage caps, which would prove devastating for Anthony and others like him when the time comes that they'll be responsible for their own health insurance and care. In addition, I've recently read articles stating the AHCA will also allow for employer-sponsored insurance to exclude or limit these and other essential protections as a method of reducing costs for employers and insurers, putting those with pre-existing conditions at risk under a whole other set of circumstances. There are two red flags that I've come up with in my mind over the last 24 hours that speak to the heart of this bill. The first is that Congress has written their own exemption to the AHCA so they can remain covered under the ACA. If this bill is so good, why won't they accept the same coverage? If it's so good for America, why can't they be covered under it as well? And their staff and their families. Secondly, is the fact that this bill has been pushed to vote without a CBO analysis and score speaks volumes to me that they may in fact know how bad this is. I was taught that if you can't tell your mom, or in this case your constituents, what you're doing, it's probably wrong. A full analysis by the Republican appointed and led CBO would tell the American people what this would do to them and their health care, and that probably scares the GOP to death. I want to make it clear that I do not think the ACA as it currently stands is the answer. However, the GOP approach of repeal it or let it implode is definitely wrong. To me, it's like having a brakes issue on your car and only having the options of get rid of the car or wait until we crash. There's a third option. It's called fix it. Instead of just trying to get rid of the ACA in order to erase the record of President Obama, come to the table with areas that need improvement and start the conversation across the aisle to get it done. To repeal the ACA with the AHCA or any other plan that does not include essential protections such as pre-existing conditions and eliminates coverage caps, limits, does nothing short of condemn the chronically ill and their families such as mine and millions of others across the country. Now I'd like to introduce Ken Kenegos, a registered nurse and healthcare provider.
Good morning. Good morning. My name's Ken Kenegos. That's spelled Kenegos is the last name. I'm a registered nurse. I've been a nurse for over 40 years. And there's one thing I've learned being a nurse, and that is that health care is a human right. And we must start from that premise.
That's right.
You know, people are characterizing this Republican proposal as a large tax cut for the top 1%. And it is. It also, as people have already stated, takes millions of people off their access to health care. But it does something else. It's an admission that private health insurance will not give us universal health care. The high-risk pools, which will be horribly underfunded and will continue to grow as more people develop illnesses, those are designed specifically to protect the profits of the health insurance companies. It's okay for us to use our taxes to protect their profits with this thin veil of health care for those with pre-existing conditions. But it's not okay to use taxes to finance health care in general. The insurance companies need this to survive, but their survival is only short-term, and we all know it. More and more people are realizing that what is needed is a real, truly universal and affordable health care plan, and that is expanded and improved Medicare for all. There are now 109 co-sponsors of that bill in Congress. Okay, I had another phrase here. Our message to our representatives does need to be to stop this awful attack on people's health care. But it also needs to be to demand what we really need to end the whole parasitic relationship between health insurers and the public's health. They do not provide health care. They take money out. What we need is improved and expanded Medicare for all, because health care is a human right.
Thank you, Ken. Next up, we've got David Lucier, who is from the Arizona Veterans and Military Leadership Alliance.
Thank you very much for coming here today. My name is David Lucier, L-U-C-I-E-R. It's Lucier if I want a good table at a decent French restaurant. But thank you very much. I'm a veteran, and I advocate for veterans. And our model, basically, for success in the veterans community is also the formula for success for everyone. Number one, good education and training. Number two, good job and economic security. And number three, health and wellness. Without those three interrelated pieces, people will not succeed. Now let's talk about specifically this GOP non-healthcare bill. This is a tax bill giving over $850 billion to the upper 1 to 2% of the people here in the United States. It's not repeal and replace. It's repeal and repeal. Let's get this straight. The essential health care benefits, they're gone. Guarantee for pre-existing condition, they're gone. Funding for those precondition elements are pretty much gone. The number today is about 25 billion over a 5-year period. The estimates are that they need, in order to meet demand, 125 billion a year. So we're a little short on that aspect. I would urge each and every one of you to contact your representative, both House and Senate, and encourage them to get rid of this particular tax break, to get rid of this repeal and repeal piece of legislation, and look at alternatives for health care for all. Thank you very much.
Thank you, David, Mr. Lucier. My name is Rod McLeod. I'm with the Alliance for Healthcare Security. My name is spelled R-O-D-D-M-C, capital L-E-O-D. I just wanted to wrap up before we open for questions with a few key points. Point number one is that every single member of Congress and President Trump who promised that people with pre-existing conditions would be protected under this law, if they vote yes, that is a broken promise. This law does not cover folks with pre-existing conditions. The analysis that came out from CNBC this morning said that only about 5% of those folks would be covered. Point two is that this bill will decimate the Medicaid expansion. Our Republican governor, Jan Brewer, who spearheaded the Medicaid expansion here in Arizona, she's described Arizona's Medicaid program, excuse me, did I say Medicare? I meant Medicaid expansion. Here in Arizona, we call Medicaid access. It is the gold standard of Medicaid programs in the United States of America. It covers almost 2 million people here in Arizona. That's 2 million people out of 7 million who live in the state have their health insurance coverage through Medicaid, called access. 400,000 people will lose that coverage under this bill. The money that the Congress will save by kicking all those folks off health insurance will be given to the top 1% and 2% of income earners in this country in the form of a giant tax cut to the rich. It is literally an $880 billion cut from Medicaid and an $893 billion tax cut. That is very close to a 1-to-1 ratio. Last, I would say that the Obamacare program has what's called essential health benefits. It lists 10 benefits that every insurance plan to be sold on the market has to cover. That also goes out the window under this bill and allows states to just toss that away. So when President Trump said, and I quote, "Everybody gets coverage, everybody will be covered," this bill does not keep that promise. And so Trump Care is McSally Care. Martha McSally just voted yes on this bill. The vote is still open. She could change her vote. But right now on the big board in the United States House of Representatives, Martha McSally is a yes. So most Arizona representatives are voting no. But if this passes the House today, it will then go to the Senate. And we are counting on our senators, John McCain and Jeff Flake, to preserve the bipartisan Medicaid expansion that got passed in this state. Medicaid is a success story here in Arizona. 2 million out of 7 million people get good, effective, affordable, cost-effective health insurance coverage from Medicaid. And it was a bipartisan coalition that made that happen in 2013 and 2014. And we should hold that where it is and make sure that people continue to get the health care they need. I thank you for being here. All of us are ready to answer questions if you've got them.
I'm seeing a lot of single-payer sentiment here.
Yes.
And that is the thing that caused so many people to oppose the ACA in the first place. It was the camel's nose under the tent of single-payer. A lot of people still oppose single-payer. Most people. What is the assurance to voters that the ACA as it stands now and continued protection of it doesn't still represent that move towards single-payer that they oppose?
The camel's nose under the tent for single payer is a bill that was passed in 1965 and signed into law by Lyndon Johnson. It's Medicare. Medicare is a single payer system. What the Affordable Care Act did was it left Medicare in place for Americans over 65. It expanded Medicaid for folks who don't earn enough money to afford insurance or whose jobs don't provide insurance. And then it expanded options for people who get their insurance either through their employer in an employer marketplace, or individuals, like I'm an individual, I buy my own insurance on the individual marketplace. And I could barely find insurance until the ACA passed. So what the ACA did was not create more single payer, it just created more options and expanded every part of the system so that 20 million more people got health insurance. We're going to have some kind of debate about what we're going to do. Even under the Affordable Care Act, there are 30 million Americans with no health insurance, but it beats the 55 million Americans with no health insurance that we had beforehand. It should also be pointed out that under the Affordable Care Act, the increase in costs for premiums slowed down dramatically. For people who get their insurance through their employer, before the Affordable Care Act, in the 10 years before that, premiums were going up by double-digit percentages. Premiums have only been going up 3 to 5% under the Affordable Care Act. I'm talking about for most folks who get their insurance through their job. It's become a more stable, effective, sustainable system under the Affordable Care Act.
But we have seen some triple-digit increases here in Arizona. Did yours go up, by the way? The one that you buy individually?
Yeah, mine went up about a little bit, but $100 a month. But here's the reality. I wasn't even able to find insurance. So when we talk about the individual marketplace, there are 200,000 plans sold in the state of Arizona on the individual marketplace. That's out of 7 million people. We're talking about 3% of the public. So when Donald Trump or Paul Ryan or Martha McSally or David Schweiker tell you that there's only one insurer in their county and that it's a disaster for Arizona, that's a lie. There are many insurers. Now, on the individual marketplace, that affects 3% of the people in Arizona. Yes, the marketplace is not functioning properly. There's only one insurer per county. But people are also getting insurance through Medicaid, through Medicare, through their job. The 96% of people have more options and cheaper options and more affordable options under the Affordable Care Act. Other questions?
Can I respond to one thing you said?
Bring it.
I just want to correct you on your statement that people are not in favor of a single payer system. All the surveys that have been done where it has been laid out what it would do and what it constitutes have been a majority of the American people favor it. Over 80% of Democrats and 40% of Republicans favor it. It comes out to about 55 or 60% total in favor.
Does anyone have any more questions for us? Well, thank you all very much for being here. Appreciate it.
Republicans, don't kill Arizonans. Don't take away our pre-existing